Hello, future doctors. Welcome back to MedSteps ECG Series, Day 12. So, in our previous lecture, we learned about left axis deviation, how to identify it, and its common causes. So, myself, I'm Dr. Anand, final year medical student. So, today we are going to learn about very important topic, that is right axis deviation. So, this right axis deviation is an important ECG findings that often indicates right-sided heart disease, pulmonary disorders, or conduction abnormalities. So, by the end of this lecture, you will be able to identify right axis deviation within a few seconds and understand its clinical significance. So, without time waste, let's begin. So, what is right axis deviation? So, normally the electrical impulse travels downwards and slightly towards the left ventricle. Okay. So here what in right axis deviation, what will happen when the electrical impulse shifts more toward the right side? It's called right axis deviation. So in definition, right axis deviation, the QRS axis, we can see that is plus 90 degrees to 180 degrees. So we have to always remember the normal axis will be like minus 30 degrees to plus 90 degrees. The right axis deviation will be like plus 90 degrees to plus 180 degrees. So in simple analogy, same to same, like last episode, we discussed about imagine a compass, and normally the arrow points slightly to the left. In the arrow turns towards the right side, that represents right axis deviation. Now, how to identify? So if you are seeing here, this is the trick we have to identify right axis deviation. So how to identify means always we have to look at two leads, that is lead 1 and lead AVF. So the lead 1 will be like always negative. Okay, it will be like negative deviation means it will go down, that spike. Okay, in AVF it will come up, so positive. So if lead 1 is negative and lead AVF is positive, then diagnosis, that is right axis deviation. Okay, so we have one memory trick, that is if lead 1 and lead AVF is positive, then we call that is normal. If lead 1 is positive and lead AVF is negative, then we call that is left axis deviation. If lead 1 is negative and the lead AVF is positive, then we have to call that is right axis deviation. And we have both are negative, then we have to call that is extreme axis deviation. Okay. So why does RAD occurs? The electrical impulses shifts toward the right because the right ventricle becomes enlarged, and the right ventricle work harder compared with the left ventricle. Then after the conduction pathway will changes. Okay, so we have some common causes of right axis deviation. Let's discuss the important cause one by one. Okay, so the most common causes will be like we can see pulmonary hypertension, chronic lung diseases, and congenital heart diseases. This is the most common causes. Okay, so the common causes of right axis deviation. So first of all, we can see here that is right ventricular hypertrophy. In right ventricular hypertrophy, the most common cause will be like right ventricle become thickened and more muscle mass. It creates more electrical activity, and the electrical axis shifts toward the right. So the main causes will be like we can say pulmonary hypertension and chronic obstructive pulmonary disorder and interstitial lung diseases and um, long-standing lung disease. Okay, and congenital heart diseases. Okay, so next you can see here that is chronic lung disease, that is like core pulmonary. So in core pulmonary, we can say long-standing lung disease and increases pulmonary artery pressure. Okay, and the right ventricle must pump against higher resistance. So this leads to right ventricular hypertrophy, right axis deviation, examples like COPD and interstitial lung diseases. So next we can see that is pulmonary embolism. In pulmonary embolism, we can see like next we can see pulmonary embolism. So in pulmonary embolism, that is the large pulmonary embolism suddenly increases pressure in the pulmonary circulation. So the right ventricle becomes strained. So the ECG may shows like right axis deviation, sinus tachycardia, and right ventricular strain or pattern. So next we have that is left posterior fascicular block. So this is the left posterior fascicle is blocked. The electrical impulse travels to the left anterior fascicle first. So this shifts the axis toward the right. So the main point thing is the left posterior fascicular block is an important conduction cause of right axis deviation. So next you can see that is congenital heart disease, like certain congenital defects cause chronic right ventricular overload. Examples like atrial septal defect, tetralogy of folate, and right-sided overload. So this may produce right axis deviation. So in ECG findings, typical ECG findings, we can say lead 1 will be like negative QRS and lead AVF will be like positive QRS, and it sometimes associated with the tall R wave in V1 and deep S wave in V6 and suggests right ventricular hypertrophy. Okay, why this right axis deviation is important? So, for example, a 65 years old man with severe chronic obstructive pulmonary disorder presents with shortness of breath. The ECG shows lead 1 negative and the lead AVF is positive. The tall R wave in tall R wave in V1. Then you have to suspect patient have right ventricular hypertrophy. Okay, so if B5 and B6, we can see if you're seeing tall um, R wave, then we have to suspect left ventricular hypertrophy, right? So in if you are seeing like tall R wave in V1, we have to think right ventricular hypertrophy. Okay, so why is right axis deviation is important? So the right axis deviation is not a diagnosis by itself. It's a clue pointing. It's a clue pointing toward conditions such as like right ventricular hypertrophy, pulmonary hypertension, pulmonary embolism, and chronic obstructive pulmonary disorders like core pulmonale and conduction defects. Okay, like left posterior fascicular block and chronic lung diseases. Always we have to correlate with clinical context and full ECG. So in differential diagnosis, if tall R in V1 means we have to suspect right ventricular hypertrophy. Is S1 Q3 T3 pattern means we have to suspect pulmonary embolism. COPD signs, you can see core pulmonary sign symptoms and everything. Wide QRS means we have to suspect conduction defects like a bundle branch block or fascicular block. We have to suspect. Okay, in systemic ECG approach, whenever you are seeing any ECG, we have to check on cardiac axis. We have to look at lead 1, then after lead AVF. If lead 1 is negative and AVF is positive, then we have to suspect patient have right axis deviation and we have to search for the underlying causes. Okay, so these are the main things. So today in today lecture, the main high yield important points is right axis deviation means plus 90 to plus 180 degrees. If left axis deviation means minus 30 to minus plus 90 degrees, that is left axis deviation. So the quick ECG patterns we can say like lead 1 will be like negative and lead AVF will be positive, that is right axis deviation. The most common cause of most common causes we can see that is right ventricular hypertrophy and pulmonary embolism and COPD, core pulmonary, and left posterior fascicular block. This left posterior fascicular block, important conduction cause of right axis deviation. Okay, so this is the thing. So always look for the underlying causes. So this is the main things. So now In simple, right axis deviation means QRS axis plus positive 90 degrees to positive 180 degrees. Lead 1 negative and lead AVF will be like positive. So that means that is right axis deviation. The most common causes will be like right ventricular hypertrophy, pulmonary hypertension, chronic obstructive pulmonary disorder, and pulmonary embolism, and left posterior vesicular block. So excellent. Today we'll learn how to identify right axis deviation and understand its clinical significance. So in day 13, we will bring everything together by learning a step-by-step systemic approach to ECG interpretation. So the same method used by clinicians in daily practice. So see you in our next ECG lesson on MedSteps by Dr. Anand. Till the time,